Hi, I'm Suhani Mohan. I lead the Environment Fund at ACT Grants, and you have seen what ACT does over the last couple of sessions. This is a particularly exciting session where we have clubbed in conversations for health and climate both. So let's get started. I think in the last couple of years, we have seen a pandemic and severe climate events in the past, like the heat wave in Maharashtra, poor air quality in Delhi, flooding in Bangalore. So we are all aware that the situation of climate and health and solutions required are really urgent. Despite having a thriving startup ecosystem in India, we still find that climate and health startups are not able to scale much. It's also interesting to see that particularly in climate and health, there are more deep tech, hardware, science-based solutions which are required to solve these challenges. And there is a very different kind of capital that is required to support these. They require a longer gestation period. There are more regulatory hurdles. The market is really fragmented if you look at reaching out to farmers or primary health centers. The idea of this roundtable is to actually seed ideas from here and then divide it in ourselves into groups and really come together as an ecosystem to see what all are the areas and gaps that we still need to cover to make sure that these health and climate startups are able to leap over the valley of death. And that's why the name of the topic. So I'll quickly jump in and start with the journey of a very prolific founder, Dr. Geetha. So Dr. Geetha is the CEO and CTO of Niramai Analytics. They have developed a unique AI solution for breast screening, which is non-invasive. I'm sure a lot of you already know her. So Dr. Geetha, I wanted to understand what has been your journey in building a deep tech solution in India, and from challenges of starting to regulatory approvals go to market, and now what are the unique challenges at this stage of your journey?
Yeah, so for those of you who don't know what we do, we have built a new method of detecting breast cancer, which is affordable, accessible, and also deep tech in the sense it's a unique solution in the whole world, where we are trying to make breast screening privacy aware, where nobody sees or touches the person, and also more accurate than the current standard of care, which is mammography. And I know there could be skeptics around it, but yeah, we are trying to create more and more proof points there. That said, the challenge of trying to build a solution for cancer itself, brings a lot of sort of immediate requirements to be ticked, right? To even try it out on the first set of patients. That is, clinical provenance of the solution becomes very, very important. And so when you go to a doctor and say, like, here is a new solution, to detect cancer, the first thing they will ask is, I have never read about this solution or any other company or a US company doing such a thing. So how does it work? Does it really work? So having the clinical studies is absolutely critical for any health tech startup just trying to do provide a clinical solution, a clinical what you call a CDSS, like clinical decision support, because this is important to make affordable healthcare affordable, actually, because more and more automation is needed. We talked about how we can use AI for it. I think there was Steve who was talking about the 3 points, and I was saying, like, Niramai tries to sort of tick all the 3 points he said, because use of AI to automate the triage solutions, right? Triaging for different diseases is really feasible, and it really makes rural people, for example, if you're screening for 100 women, how do I pick those only 10 women to bring into the urban ecosystem for further diagnosis, as opposed to getting all the 100 women in, right? So this, when you think about scale, this filtering can be done with AI. So for that, again, rigorous clinical studies are needed. Then, of course, health tech generally goes through a rigorous regulatory clearances for every country, right? For India, it was a little bit lenient, but now they've come back and sort of made it much, much stronger. They have all class A, B, C, D done, and so on and so forth. So regulatory clearance is important. So first, technical accuracy to be proven, clinical efficacy to be proven. When I say clinical efficacy, just to give you an idea, to do a clinical study of 256 women, we took 2 years, because that how rigorous it is, right? To get all the documentation cleared, get a CRO in between, and so on and so forth. So like one of the panelists was mentioning, it's really about having patient capital for impatient entrepreneurs, so that is what becomes more and more significant in healthcare domain. After that, regulatory clearances for every country, right? So what we saw is once we got a US FDA approval for one of our devices, the adoption in India increased. There's no reason why we need US clearance for Indian usage, but that's the sort of the mentality we saw. And then we got the European clearance. It's much easier to get the adoption done. And the last one, I mean, there are several, but I'll just sort of say, India is very, very diverse, So if you really want to reach people in the rural areas, you need to get to maybe less than 100 rupees per scan, or even like 50 rupees per scan, if possible, less than that, right? And how do we sustain ourselves when the costs of even the cloud analysis or AI analysis, and you're trying to do all these clinical studies, regulate? How do we sustain by creating impact as well as get a differentiated pricing in the urban areas? So there again, we had to do some innovative methods of having multiple product models. One which is just a triad solution priced at a different price point versus a full detailed reporting, which can be priced maybe even 10 to 15 times higher. So, and then provide that same value for people paying higher, right? So those are several of the challenges, I would say. At this time, we are moving from being an impact or a social impact kind of startup to the Series B. Or rather, we're going into Series B, where we are pitching for Series B investors, where they see the revenue mainly, right? So the impact part gets sort of a little bit unnoticed, and they now want to see the revenue. So suddenly we have to see how do we maintain the impact, but also show the revenue, so that we can have the next level of investors come in. That's a little bit of a kind of a major bridge to cross, and we are on it. So that's another one yet to cross. Yeah.
I think one of the things that I loved in terms of what you said was patient capital for impatient entrepreneurs. And that's a key takeaway from your conversation. But I just want to applaud the journey that you have been in and moving from a social enterprise to actually a Series B startup. And it's a very hard journey. So just want to thank you for the good work that you're doing for the women in India. So with that, I want to move from an impatient entrepreneur to a patient backer of healthcare and biosciences companies. So Dr. Taslimarif is the CEO of cKamp, which is based in Bangalore, and they back innovations from translational research to actually market readiness. And I think they have backed multiple bioscience and healthcare companies, and who have seen the success that we all want to see for our partner companies. So I just wanted to ask a very different question, and not so much about capital, because capital is something that we can provide. But what is the other ecosystem support that you provide from cKamp to the company so that they can cross the various challenges that Dr. Geetha talked about?
Sure. No, thank you, first of all, Suhani, and good to be here. I think this is my formal interaction first time with the ACT. So if I may just put a note of admiration of the work that ACT did in the times of crisis, I think it was very heartening to see it from close quarters. I think congratulations for the people who were involved in it and the entire team. Coming back, I think thank you for kind words. So just to introduce myself, I'm Taslimarif Saiyed. I work at cKamp, that is Center for Cellular and Molecular Platforms, based out of Bangalore. It's an initiative supported by Department of Biotechnology, Government of India, largely as a catalyst, an enabler of deep science research in life sciences and innovation. So I use the analogy like a midfield player on a soccer field, which actually ensures that the movement of science goes to the impact that is the scoring the goal. That is a very important thing. So how do you catalyze? How do you actually not only accelerate, but you actually get involved in terms of from the right flank to the left flank and left flank to the right flank, and dodge the defenders from the hurdles the value of deaths which are there, and how do you do that? And that's where you have to be very involved. It's not an easy field. So when we started, if I come to it, when we started, we are a part of India's largest and possibly on top of the Excellence Life Science Campus called Bangalore Life Science Cluster. It has 4 organizations. Together, we are 2,000 people there. It has NCBS, National Center of Biological Sciences, which is a part of TFR. It has INSTEM, India's only stem cell research institute. And it has TIGS, that is Tata Institute of Genetic Society, along with CCAM. So together, we are 2,000 people. It has a seamless environment of conceptualization of science to all the way there. So when we started, we actually, if I may use the word, we had a very determined mind that let's move the science forward. So early stage of movement of science, in a way, a little bit of techie feel to it, that we will do that. And we have been doing it for now almost 14, 15 years. As we went forward, and most of the stories were actually, resulting and bearing fruits, we realized the gratifying feeling that those innovations are actually giving us back, which we wasn't really the case. Idea was that, oh, amazing science is happening, why don't we push this forward? But now suddenly we have now invested with government partnership and all, almost in 360 companies, which is a significant number, a critical mass which is very much required. And all those have been screened after possibly 10,000 odd startups which have come and presented to us and gone forward. So there's a really solid world level ideas that we have supported. And we have now 60 to 80 products in market. And once those started working out, we realized the impact is humongous in terms of the quality, but possibly in terms of the quantity of impact is something that is a bit missing. And that is what I meant is a challenge that we are seeing now. Come COVID, around the time when we all ourselves realized that where is the impact? Can we do something? When in April 2020, people started saying that what can we do now, since India hadn't had solutions? We looked ourselves and said that are there any products in the backyard, our own backyard, which are near ready, near deployment ready, which we can take and then help them go to the different places. We ran a program which got supported by ACT, small part supported by ACT, called COVID-19 Innovation Deployment Accelerator, which had several partners, including who are in this room. And that was, within a month of April itself, 2020, we got 1,100 applications. We selected 30 of them, and 23 of them actually are in market now, serving in 18 states. That was the power of picking something, assessing them early, then working with state governments to ensure that they can deploy it. So now we have moved from one spectrum of the science through starting to now moving as a deployment, 2 different spectrums of the impact. And this is where we want to now work in as well. So, so in a way, as one would say, the ones who are ready for impact. So when we are supporting them early stage, it has a potential to impact. Now they are ready for impact, and how do we want to do it? So we have a dedicated program, which we call it Technology Impact Program, where once they are ready, their due diligence done, science is done, product is done, technology is done, regulatory affairs are done, understanding is done. We actually help them work with the public health secretaries, National Health Mission, Health Commissioner, and ensure that we actually build the first level of pilots. We build first level of evidence generation models. We have done it in 6 to 7 states of Northeast. We have done it in Karnataka, Tamil Nadu, Rajasthan, and many other states. And that has been remarkably now gratifying that these guys are now making impact and, making porous boundaries in a very difficult walls of healthcare, which is not easy to penetrate. And that is something that we are hoping to build on. And I would say, just if I name out, there are a list of companies, including what Geetha just mentioned, but like SpotSense, first one in the world to do for a neonate a saliva-based detection for inflammation marker. We all do hill pricks, if you know, and you can't take from a neonate too many times a hill prick because blood you can't take so much. We have that done. Safdarjung hospitals have done it. We have to help them go to the next level. InExcel is only first one and US FDA approved prevention of the 4 most fatal condition in ICU called ventilator associated pneumonia. Again, this is from us. We have built it. We have done the hard work of picking it. We are not saying that we are at the world stage, but once we have built it, why are we now not converting it and making the impact out of it is something that I would say. There are few more. String Bio, which is converting carbon capture from a perspective of methane gas, which is global warming gas or a greenhouse gas, into alternative protein. You have Janitri, which is doing fetal monitoring at the same time. And you have Sensivision, which is for the early stage brain damage that happens because of hypoxia in kids. This all innovations have come out of here, right? And what we need to do is make sure that they actually reach the impact and the scale. And the title of the today's thing, which I was trying to build on, is catalyzing the scale of impact. We have innovations, we are building new innovations as well, but the ones which are here, how can we scale them up? Would be a remarkable way for us to discuss it and take it forward. I'll stop here and happy to expand on it. Thank you.
I think what you mentioned, an act for health and act for environment, really resonates with this, that there are a lot of innovations happening in labs. And we typically like to look at somewhere between where an MVP has happened, but the product market fit or the market adoption is yet to happen. So there is a big gap where catalytic grant capital can play a role. But the support that you also provide with implementation, working with governments, is something which is extremely unique to CCamp and has helped create all the success stories that you talked about. So thank you for sharing that. With that, I want to move to Smita. She's a partner at Social Alpha and leads the climate and sustainability vertical over there. And Social Alpha looks at both health and climate innovations, and primarily from the lens of entrepreneurship solving impact challenges in the country. My question to you is slightly different and more specific to something that Social Alpha uniquely does. You run a lot of cohort-based programs for entrepreneurs which focus on specific grant challenges. So just wanted to learn from you, what were some of your key findings and learnings in running some of these programs, and what is the role that these grant challenges or cohort-based models play in the journey of climate and health startups?
Thanks, Suhani. So before I answer that, I must clarify what Social Alpha is, because we'll be confused with an accelerator if you've heard the story of the elephant, if you touch its trunk, you think it's a snake, and if you touch its tail, you think it's a broom. If you touch its leg, you think it's a pillar. We face the same problem. People who've engaged with our accelerator think we're an accelerator. People who've engaged with our incubators, which 2-3 of them, they think we're an incubator, and then partners or startups that have engaged with our investment engine think we are an investor or an impact investor, which we do not like to call ourselves. So essentially, these are all toolkits. We are this animal which is trying to find its category, and to be honest, play between the not-for-profit and for-profit world. So we are a hybrid sort of an animal which is trying to essentially bring any toolkit that it may take, any tool from our toolkit that may be required for early stage entrepreneurs in healthcare, in climate, in livelihoods, especially of small and marginal farmers. Now, these are spaces most difficult to crack. I'm sure all of us work in these spaces and we know. Therefore, you can't have an answer, you can't have a cookie cutter approach, and you can't have, you can't have one solution that we feel like has worked and therefore will work for everything. So that disclaimer I thought was needed before I dived into talking about in what ways some of this bringing together startups work. And for all of you who are startups here, I'm sure you must have at least been through 4 or 5 of these cohort-based programs and therefore hate to death a large part of it. And so I'm going to tell you what works in this, right? And I know, Anish, you're grinning. And therefore, I'll take the specific example of the cohort-based program we've done where Ashaya is a partner. And for anyone who's not met Anish and learned about Ashaya so far, please grab a minute and do that. So what do theme-specific, challenge-specific grant challenges or cohort-based programs allow us to do? Or why do we do it knowing that it runs the risk of becoming a cookie cutter or becoming something that's run-of-the-mill program, right? Few reasons. One, when you do that kind of a program, it helps you align stakeholders on a very specific objective and theme, which usually doesn't happen. So even if we say something as specific as waste management, and even if you bring a category saying textile waste, someone's coming there with a waste picker angle, someone's coming there with the recyclable alternatives angle, someone's coming there with just GHG avoidance angle, right? So unless we align, and this is a problem of the dev sector in general, as we all know, our alignment of what does it mean, what does success, what does impact mean for us often is a struggle. And therefore, these kind of challenge-based cohorts become more like SPVs, not legally, but more for operational purposes, because they're very focused very time bound, where everyone basically aligns themselves to one objective. An example that I'll take, and we run many of these programs, is that in the waste management space, we formed a consortium along with H&M Foundation and many other, in fact, total 10 partners, which says in the circularity and waste management space, if we all are organized in concentric circles, how do we bring in waste pickers at the center of it? Now we come in with a startup support, kind of an intention and motive. Someone might come in with a very specific problem statement, like Ashaya does, which is of MLP waste recycling and value adding. But how can we all converge on the single goal of waste pickers' income and livelihoods? Because in India, as long as the problem of waste continues, waste pickers are going to be the most affected stakeholder group, right? Now, what ended up happening was, no matter what our larger value proposition and larger vision is, for that particular program, we all converged on a very specific ask, which became central in everything that we are doing. So I think sometimes that becomes a very important area. The other thing is bringing in very strategic partners. So while we have a very different vision of impact when we say clean energy or climate, sometimes when we bring in industrial partners, which we earlier thought our visions will never align with, say a Tata Power who we work with, right? Because they come with a very different business-oriented or commercial, kind of an interest, and rightly so, mindset. But at the end of the day, if you look at the same set of technologies, we are bringing in that investment, that industry partner closer to early stage innovation, for which early stage innovation will need to take years to, reach on a table where they can negotiate prices of procurement with them, right? So it helps us do that. The third thing that happens is it is definitely, it sort of avoids the ad hoc conversations that are happening, and therefore the thesis, let's admit, climate is a space where we are all learning, and every new year, every new month, there's a new set of information that makes us somewhere change the way we are approaching it, right? And therefore when you do that together, you're reducing that transaction time and cost. You're looking at multiple solutions at the same time. You're understanding gaps with multiple perspectives and not just with a single startup in mind. But let me be very honest, the biggest learning that cohort-based programs have had has been peer-to-peer learning between startups. So them meeting each other more than them learning from us or from experts that come or from the set of opportunities that arise out of it, right? Having said that, we've also been very, very mindful to make sure every accelerator-based program also has offerings which are tangible, whether it is funding opportunity or it is an opportunity to do a pilot or a POC or scale. Otherwise, it ends up becoming a lot of talk. And this is one check that helps us, make sure that it doesn't become just a very theoretical conversation, which in many times we're not adding much value on, right? So while the conversations are important, conversations happening together are important with multiple perspectives coming together. It is important to also see what outcomes could tangibly move the startup forward. So I'll pause here. These were some thoughts of on why we run these challenges. We've run these challenges in clean energy, multiple of them, for access specifically, for industrial decarbonization, for power sector specifically. I spoke about the waste management one. We have 3 challenge-based programs in waste management alone going on right now. One is looking at pilots, the other is looking at industrial integration. Now, many of these challenges, we have partners that are helping scout for these solutions and sort of facilitate this journey. And the funders are working directly with the investors and not with us. And that's fine too, right? The idea is to converge as many minds and as many stakeholders and as many resources together, to avoid that ad hoc approach. Yeah.
Thank you so much, Smita. We are glad to have you as one of our partners as well as ACT. One of the interesting things that I wanted to highlight was the industry collaboration, which gives these startups opportunities to test their solution on the go and not be market ready and then realize nobody needs that solution. And I just want to call out Prashant from HUL, who's also here, he's a sustainability champion and doing similar programs on waste with HUL. And there are many more people in the room, and I just want to make sure that we quickly come to you and also hear your opinion. Moving from the journey of an ecosystem supporter to a founder that again is Planet. Most of you in Planet know Arjun. He is the co-founder and CEO of Smart Joules. They have been working on increasing
energy efficiency in commercial buildings and hospitals. Welcome, Arjun. So you have seen this journey from developing an IoT software-based product, going into a fragmented market and crossing the value of it. From you, what I uniquely want to also hear about is there are multiple funders and ecosystem partners in India. What do you think people should keep in mind before they come to back climate solution systems? And if you could share a little bit more about some of the people who helped you in the journey as partners, funders, investors to cross the value.
Thank you. So we've had the good fortune to be able to benefit from multiple types of capital. In the early days, it was grant capital, and Tata Trust provided a 2 lakh rupee grant. That was the second grant. The first one was from the US, echoing green, and there was another one from Packard Foundation. So a bunch of grants in the beginning to get us going. That was really great. Then the second type of financing that we were able to benefit from was profit. So I think that's something that all entrepreneurs should keep in mind. There's no better financing than profit that we generate. So we did not need any more financing for about 3-4 years until we were ready to scale. Then with the scaling, of course, when you want to scale faster, maybe your profits are not enough, then we went for equity fundraise, which we were able to get. And beyond that, the debt financing from Tata Clean Tech Capital and Citi and Yes Bank and few others who want to do something about sustainability and have specific programs. And some of these are also backed by the World Bank. And the only reason that Citi is going to lend to a project of a relatively young small company is because the World Bank says here is a risk guarantee. So I think
we have benefited from a vast range of financial instruments. And that is very, very important for our success, because what we are doing is investing in the right places. We are investing in energy efficiency, whether it's creating our own technology or in specific projects in the sites of our customers. So what has helped, I think, in general funding, what you asked, what is my request from the funding community? For climate, I think two things. First is little longer term thinking, which I think all founders will tell you. Nothing new, but if you just look at how many funds we have here in India and what is their horizon, right? 5-7 years is the majority. Majority, I mean vast majority, right? Where are the funds that have a 15-year and an 18-year horizon? They are not here. And that is forcing entrepreneurs to look outside for funding rather than look within India. So we are losing the wealth creation opportunity here because our LPs are giving us money for only 7 years, right? I'm talking from the funds perspective. So longer time horizons, raise funds from LPs who have longer term horizons so that you can invest longer term. That is one. Second, I think is like Social Alpha mentioned that, that you need to be partners. So I'm at least lucky to know a lot of founders who have good partnerships with their investors. That means beyond money, what else are they bringing on the table? Are they helping them solve real problems? From all the people that have backed us, a couple of them have been extremely helpful. And I think every founder goes through ups and downs. Like right now, we always start fundraising at the wrong time. For Series A, it was during COVID. We were able to do it anyway, and now it is another slump. So in these downtimes, you need support, right? So maybe we need another couple of $1 million from our existing investors until the environment is better. Otherwise, we end up diluting too much. So I think that long-term thinking and partnership approach with the companies that you're working with is important. And sometimes that means allocating a little bit more follow-on. You've invested X, keep a little bit more kitty for later on, and also look left, right, and center. What's the next investor that this company wants, and bring them to the table early so that that comfort is built early on. So I think those are some simple things from my side. Thanks.
So thank you. I'll move to Sumit now. I know that he has a very contrarian viewpoint to long-term patient capital. He's the MD of Climate Angels. It's an angel group that invests in climate, as the name says. But I just want to hear your viewpoint. You have backed deep tech technologies in climate. How do you manage the expectations of your angel investors, the return cycles, and yet back really solid climate ideas?
So I'm Sumeet. I lead Climate Angels Fund. We're a SEBI Category 1 Angel AIF, investing only in climate tech founders. We made about 12 investments till date. The network has about 500 investors, about 120 signed LPs who have actually deployed capital into these climate tech startups. For founders, the first message. See, these are angel investors, right? They have X amount of capital which is available, and there's only particular amount that they're going to put in startups. You're actually competing with your standard B2B SaaS, consumer internet, the regular startup. So there is, if we tell them, if you go and tell an angel investor that, hey, no, the perspective is different, or we need to have a different set of clauses, they're comparing two term sheets. They love the founders. Ultimately, they're backing the founders. One is a great founder in climate tech, the other one might be a great founder in SaaS. So it's very difficult when you're, and this is, so it's actually very difficult to convince somebody or to talk to somebody and say that, hey, no, if you do this, you want to be more patient, the return time period will increase, or whatever. The commitment is not going to happen, which is why, and I tell the founders very clearly upfront that, listen, hey, there's going to be no, sacrifice on certain standard clauses. They are going to stay there. They might not get enforced, but you need to have that kind of a perspective. You need to be able to run that fast. You need to be at a stage where you can run that fast to be able to pick up that capital. Talking to a lot of corporates and institutional money, institutional capital providers also over here, the kind of capital we are deploying is very different. This is your personal FDs that you'll break and deploy. So unfortunately, at that point of time, yes, the questions that get asked are, what is the exit multiple what is your exit multiple horizon? What is your exit time period horizon? 5 साल में क्या top line हो जाएगा इसका? What is the growth potential? So these are a standard set of questions. I have one angel investor who probably has 10 criteria. There's one angel investor who has an Excel sheet with 100 criteria. Now, that is something that he developed when he was doing consumer internet or something like that. He's using the same Excel sheet to evaluate a climate tech startup. And the same is the case with a lot of institutional money. They want to back sustainable startups. But those frameworks don't exist. We are working to create those frameworks. A lot of learnings will get deployed. Notably, like Pran, filterless air purifier, we backed them on TRL5, literally on a YouTube video. Biko we invested, which was a D2C startup, when they were doing 25 lakh rupees a month top line. So, the lenses have to be different. The evaluation, it gets quite, it's not a simple question, but at the end of the day, in terms of patient capital and long-term capital, you're going to be evaluated at the same lens. That's the hard truth, that you'll face. I would love to see it change, and let's see if we can come up with the framework, but that's the hard reality today.
I think I'm excited that there are contrarian views here. It will add a lot of potential for discussion when we move to the roundtables. But moving to Jayant, Jayant is the CEO of cKers Finance. They are a debt finance company that funds climate tech solutions. So debt is generally seen as low risk appetite type of funding when we traditionally look at it from that lens. How have you managed to use debt and support climate tech innovations? Would love to hear your opinions on it.
Thanks, Suhani. Thanks for not giving me a trick question. But I mean, before I go there, I think I'm privileged to be on the panel where we've heard a lot of interesting stuff. I mean, we have heard about how you bring innovation to market, the power of focus, the power of ecosystems, mixing and matching capital, right? And the fact that it's a dog-eat-dog world, you have to compete with 20 other interesting ideas when you're trying to get an investor's attention, right? So from our perspective, from cKers, when we looked at this, right, we said we are not really here to fund the deep tech stage of climate finance, right? Because when we are doing debt, we want to be cash flow orientated. When there are cash flows, we'll fund those cash flows, right? Arjun talked about the power of profit. So if there are present and future profits, we are discounting that for the venture. Now, what ends up happening is a lot of people come in when they're still in the lab, when they're going from lab to the field, the solution is not proven or the business model is not proven. That we still walk away from, right? So we end up meeting upwards of 10 or 15 people for every one we invest in, probably in some sectors even more. because there are people at various stages of evolution, and they are all saying, look, we don't know where the providers are, or we are not clear what kind of capital we want. And they are trying to go to everyone, and to person A, they will say, hey, we are an apple. To person B, they will say, we are an orange. To person C, we are saying, hey, no, fruits are bad. We are something else. We are a tree, whatever. So our perspective is, when you're looking at it, the technology has to exist. The technology has to work. Cash flows have to start. And then debt comes in. The Indian ecosystem from a debt financing perspective still doesn't do cash flow financing at that stage, right? It's very oriented towards either name-back lending, large corporate houses, or property-back lending. We've sort of said that, okay, if we are playing in this, we have to do cash flow back structures, which we did, and we have to get in more capital in. So we usually go and take our investees to mainstream debt providers, etc., saying, hey, do you want to invest in this? There is enough amount of awareness building which happens there. Some of them move, some of them don't. So some sectors, because of lots of equity capital pouring in, suddenly you have a line of debt investors who want to invest in. They may not be interested doing cash flow back structures. In fact, some of the structures are patently non-cash flow backed, but they're still getting invested. In some places, you can see clear cash flows, but neither project equity is available nor cash flow back debt is available unless you have these things. And it's available if you're doing a project which is, let's say, $100 million and above, or $20 million and above. It's not available when you're doing micro-size asset deployments, which a lot of climate finance solutions require, right? I mean, there is no reason for us to put gigawatt scale plants only. We are starting from watt scale, kilowatt scale plants, just as an example. And then suddenly you say, hey, how do I do asset financing? How do I do project financing? The structures exist. Reluctance to move into the structures is what we are trying to bridge. Right? But then we have to avoid the pitfall around investing in people when they're still not clear on their technology, their business model. We have had companies which have come to us 3 times in the year with 3 different business lines, completely different business lines, pivoted within the year 3 times, right? And every time they're convinced that this is what we have to fund, as in cKers have to fund, because this is like, they've got it now. And therefore, we have to be patient. We end up spending time with people, which we are not compensated for, but we end up spending time with people before we find that, okay, this makes sense, this is what we can fund, but this is what we walk away from. Yeah, and then we do route them to accelerators or incubators or venture funds if that's what they need to go. Often people are reluctant, like, okay, if you don't want to do, tell us you don't want to do. Why are you telling us to go to another door? So that's also a problem, right?
Yeah.